Hey guys, Rena Malik, urologist and pelvic surgeon. Today we are doing a video on urologist versus Google. I'm sure you've seen videos like these before, and I'm going to Google what people ask about urologists and answer those questions. Let's get to it. Okay, so let's see. Urologists are useless, worthless. Are urologists surgeons? Are urologists male or female? And are they happy? So let's look at are urologists. Urologists are useless. Oh wow, pegym.com. So urologists are pretty much worthless. PE Gym forums. From what I've read on here, it seems like urologists never really fix anything and people are always just posting on here for solutions for their PE related injuries. Is my view on this just distorted because if the doctor actually did help people, wouldn't bother posting here? Or are they pretty much useless when it comes to PE related injuries? They will pretty much just tell you things you could have just figured out for yourself. Thinking about going in because my dick has been messed up for about a month and a half now. I'm starting to doubt rest will take care of the problem on its own. All right, so I had to pause for a second to take a look at what this website was about. So PE in this case stands for penile enlargement. However, when we talk about PE in the urology community, we most often talk about things like premature ejaculation. But I'll address why some people are really frustrated, at least in this forum, about urologists. If you're coming for options for penile length increasing, there are just not many that actually work. And so I made a whole video about increasing penile length before, and you can see I went through a number of different things that people have tried and done with varying degrees of success. There are really no approved treatments for penile lengthening except for those men who are having what's called a micro penis. And so that's what makes it really challenging, is that we don't have any rigorous studies that have found scientific evidence to prove that these things are safe in a large group of people and for which specific types of people they're useful for. I'll also say that when you're talking about things like erectile dysfunction, people often get really frustrated because a lot of the treatments we have just help you get an erection. They don't necessarily reverse the cause of the erectile dysfunction. And while there is ongoing investigation about those things, we don't really have yet a truly available treatment that reverses vascular problems or that reverses neurologic problems that cause erectile dysfunction. Overall, I don't think that we're useless. I think we do a lot of things that can help people with erectile dysfunction and with sexual dysfunction and problems with their penis in general. So I hope that if you are struggling, you will find a urologist that you feel comfortable with that can help you in whatever way you need. Okay, I'm going to address a couple more on this particular Google search. Are urologists surgeons? So yeah, absolutely. Urologists are surgeons. We deal with medical and surgical problems of the genitourinary tract. That includes the kidneys, the ureters that drain the kidneys, and the bladder, and of course the genitals as well. So that can include cancers of those areas where we do surgical management of those. That can include kidney stones. That can include erectile dysfunction, testosterone deficiency for men, prostate problems, bladder problems, and pelvic organ prolapse and pelvic floor problems for women as well. So we do a lot of different things. We manage both the medical and surgical aspects of them. And so a lot of urologists spend several days a week in the operating room managing these problems, as well as taking care of the medical problems like overactive bladder or enlarged prostate. And if you want to learn more about some of those medical problems and how to manage them, you can check out some of my videos on overactive bladder, BPH, and kidney stones. The next question is, are urologists male or female? So obviously I'm a urologist and hence there are female urologists, but there are only 10% of practicing urologists that are female. We are still quite a minority in the field of urology, but more and more of our trainees are women. So about over a quarter of urologists in training are women, and we're getting more and more women interested in the field, which I think is great because we have our own perspective on managing patients. And I think a lot of people actually like going to a female urologist because we have a different perspective, because we spend a different amount of time with our patients, or we have a different way of handling patients. And I think that that's great. I think there are many positives to having a male urologist and there are many positives to having a female urologist. At the end of the day, you need to find a urologist that is someone who you feel you could trust, you feel you can be open and honest with, and that you can get the kind of care that you need. All right, so let's talk about, are urologists happy? Well, I think that if you look at reports like Medscape puts out, urologists are generally happy outside of work, but there is a large degree of burnout in our specialty. Somewhere between 49 and 54% of urologists are reporting some degree of burnout or depression due to their work-life balance, due to their work. I think that's very unfortunate. I think some of the reasons are there's just not enough urologists. We need to be training more urologists and getting more urologists out in the workforce, particularly in areas where there are very few urologists, like rural areas. The burden can be shared among the urologists who are there. Also, many urologists cover multiple hospitals when they're on call, which can make call very challenging because you'll have lots of different emergencies with kidney stones or things like that that might require your attention during call at different places, all throughout a weekend or a day when you're on call. And so I think those are things that we really need to fix, because urologists are absolutely vital to the health of many, many people who are dealing with bladder problems, kidney problems, cancers, and all the things we've talked about. And so I really hope that there continues to be systemic change around the way that our doctors and urologists are treated, so that we can have people being urologists for long periods of time, not retiring early, and finding satisfaction in their work. The less burned out the urologist is, the better quality of care they're going to deliver. And so I hope that our systems will make some changes so that burnout is less of an issue. And, COVID-19 has really stressed out our workforce quite a bit. A lot of people are struggling because they have to be pulled from taking care of urology patients to take care of COVID patients now, again, with the Delta variant becoming very prevalent in the United States and throughout the world. And a lot of people who aren't being pulled out to help with those patients are not able to do elective cases or take care of their urology patients because the hospital resources are going to taking care of these patients with COVID-19. So I'm going to plug it here. If you haven't been vaccinated, please do so. It is very, very safe compared to getting COVID-19. Getting COVID-19 has much higher morbidity rates, much higher risk of hospitalization and death than getting the vaccine itself. So I encourage everyone, if you haven't done so, please, please get the vaccine. It can save you or a member of your family or a member of your community. If you guys have real questions about the vaccine, please comment them below, and I will do my best to answer each and every one of your concerns and help you feel a little bit better about getting vaccinated. Okay, let's try a female urologist is. So what is a female urologist called? We're called a urologist. Can a female go to a urologist? This is a great question. Absolutely. So we see women all the time. In fact, my subspecialty is in something called female pelvic medicine and reconstructive surgery. And what that is the care of a number of different conditions, including overactive bladder conditions that are caused by neurologic diseases like multiple sclerosis, Parkinson's disease, spinal cord injuries, and other neurologic conditions. We also take care of women who have pelvic organ prolapse, which is essentially a hernia of the vagina where the organs can actually be pushing down on the vagina and causing a very uncomfortable bulge. We can also take care of major reconstructive problems of the genitals, as well as bladder leakage, so any types of urinary incontinence. We do a lot of different things in that specific specialty that are very much geared towards women, but of course women still get kidney cancer, they still get bladder cancer, they still get blood in their urine, and they get kidney stones. So for all those reasons, you'd have to come see a urologist. Okay, so let's look at, what does a urologist do on the first visit? So I've made a video about this before, but very briefly, on your first visit, you will be asked a lot of questions about your urinary symptoms, about any symptoms specifically that might be associated with pelvic pain or abdominal pain. Depending on what you're there for, of course. And then we'll do an examination. Sometimes you'll give a urine sample. Sometimes you'll have a bladder scan or a little scan done on your bladder to see how well you're emptying your bladder. Sometimes you might fill out some validated questionnaires. And then you'll have an examination, depending on what you're there for, that may or may not include a pelvic exam for women or a rectal exam for men. And then, of course, after everything is all done, we usually sit down with the patients and talk to them about what their diagnosis is and what the options are for treatment of that diagnosis. It's very specific to what condition you are there for and can be very, very different depending on, and visits can be very different depending on what exactly you're there to see the urologist for. What does a urologist study? So to become a urologist, you have to do a few things. So in the United States, I can't speak for other countries, but in the United States, you have to do 4 years of undergraduate education and graduate with some sort of bachelor's degree. Then you have to get into medical school. So that's an application process. You have to take what's called the MCAT, which is an examination that all people take to get into medical school. And you have to do relatively well on that to get into medical school. Once you get into medical school, that's a 4-year process where you're doing 1 or 2 years of kind of book work and anatomy labs. So you'll go in and you usually work with cadavers or bodies that have been donated for science, and you learn how the anatomy of the body looks. So that's a big part of your first 2 years, as well as kind of learning the physiology of all the systems in your body, your neurologic system, cardiovascular, digestive system, your kidneys, your bladder, your musculoskeletal system. You learn kind of every little detail about all the systems in the body. And then in your 3rd and 4th year, and now even some in your 2nd year, people are starting to do clinical rotations where you'll rotate on a number of different kind of areas in the hospital. So you'll work with the medicine team and you'll rotate on medicine, you'll rotate on surgery, you'll rotate on OB/GYN or obstetrics and gynecology, on neurology, on psychiatry, on family medicine. So you'll get to rotate with a number of different specialties. And then you will have an opportunity to do some subspecialties like urology during your 3rd and 4th years, so you can get exposure to them and decide if that's something you want to do, like radiology, anesthesia, surgical subspecialties, medical subspecialties. And that's really helpful because it helps you decide what you really like to do and what you want to do. And then towards the end of your 3rd year, you decide what you want to do. Some people decide earlier than that. I happened to decide kind of in the middle of my 3rd year that I wanted to be a urologist. In your 4th year, you start doing what's called away rotations or sub-internships, depending on what your specialty is. You may not have to do an away rotation, but what that is you do a dedicated amount of time in the hospital where you are working kind of as an intern, but you're still a 4th year medical student. So you're doing the jobs of an intern and you're learning how to really work at that level, of course, with supervision. And it's kind of a time also to audition and show how good you are. And so that will help you get letters of recommendation for when you apply for residency. And then in subspecialties, you'll also do away rotations where you go to other hospitals throughout the country and kind of audition there and also see what their system is like for whatever specialty you're interested in. So when I did urology, I did my home sub-internship in urology for a month, and then I went on to do 2 sub-internships, one in Chicago and one in Los Angeles, to kind of experience those programs and check those programs out. And ultimately I matched in urology in Chicago. So you actually go through a match for residency. You don't actually get to pick where you go for residency. You apply to a number of programs, and for urology, I think I applied to like 50 programs because it's very competitive, and then you go on interviews. And at that time, pre-COVID, we were actually traveling all around the country to do interviews, and then you do the interviews, and then you have what's called a match day. So during match day, you get the notification of where you match. So you take all the programs you interviewed at and you rank them 1 to however many interviews you went to, and you don't have to rank everyone, but you could potentially match at any of those, but you would kind of put the place you want to go most, number 1. I actually put a match day video on a couple years ago, so you can check that out if you want to know what my match day story was. And so you do your residency, and for urology, that's 5 or 6 years, and that 6 years is 1 year of research. And then you graduate and you're a fully fledged attending urologist, and you can either go on and work or you can do a fellowship like I did. And fellowships last anywhere from 1 to 2 years. And there's a number of different fellowships in urology. It includes FPMRS, like I described earlier, urologic oncology, pediatric urology, genitourinary reconstructive surgery, which focuses on male reconstructive urology. And there are some for minimally invasive urology or endourology, which is the management of, typically the management of kidney stones or doing robotic surgery primarily. So I think urology is one of the best fields because we get to do such a wide variety of things. So you can learn more about why I became a urologist, why I chose urology in this video, Why Urology, which you'll see up here somewhere. Well, I hope you enjoyed this video. Let me know if you did, and comment below. Let me know if you actually liked it. Thanks so much for watching. As always, remember to take care of yourself because you're worth it.